Corona means something with a crown. So coronavirus, under the electron microscope, it has a crown, and that's why it's called corona. It is there since too many years, maybe more than 50 years it was there. And it is the cause of the common cold. So it is different than influenza virus. Influenza virus is a more severe virus, influenza A, B, and C. And the corona is the milder form. But corona, during the last 20 to 30 years, have mutated 3 times. This is the 3rd time that corona mutates. The first one, it mutated about 15 years ago or 20 years ago, and it caused SARS. SARS is severe acute respiratory illness, or respiratory syndrome. At that time, this SARS was in Vietnam and Southeast Asia. The second one, it was mutated in Saudi Arabia and in the Gulf region, and it was called the MERS, Middle East Respiratory Syndrome. And in both types, it was more severe than this novel new corona in 2019, which is called COVID-19. And the mortality rate was much higher, but it was contained in one area. The new one, which is the COVID-19, the MERS, they said that it may be from a mutation from viruses related to camels. The COVID-19 theory said that it may be coming from bats or something like that, but it is a coronavirus which is mutated. The difference between coronavirus, which is COVID-19, and other coronaviruses, which is present all over the world, is that it is highly contagious. So if one gets corona and we are 10 in the room, about 6 will get corona. But again, more than 80% of them will have mild symptoms. It's like the common cold. Only about 3% will have severe symptoms, and the symptoms are respiratory tract infection, fever, and cough and sneezing. And then it can cause pneumonia and what's called as respiratory distress syndrome, and the person needs to go to the ICU. But this is only in 3% of infected persons. The dangerous because it rapidly spread and it is contagious. For example, it started in Wuhan area in China. We have about 100 up till now, 110,000 up till today, 10,000 all over the world. 85,000 of them are in China, about 90% in the Wuhan area. And that's why, because it is highly contagious. Now there are 4 countries in the world, they have high incidence of corona, but they are not in too many thousands. We have in Iran, in South Korea, and in Italy. All respiratory viruses which we know in the past, all respiratory viruses usually they have a curve. They just come up and they have a peak and then they go down. And usually it comes up in the early winter, late autumn, and then they come down. With the increase of temperature, usually the activity of all respiratory viruses comes to a very small entity, so it goes away. And the coronavirus by itself and the COVID-19, it dies when the temperature is above 26 degrees centigrade. So hopefully when we have our good summer weather, it will go away. COVID-19 mainly affects those who are over 65, and the mortality in these people over 65 is mainly in those who have a low immunity, especially who have chronic respiratory diseases, who have uncontrolled diabetes, who are taking immunosuppressants, and so on. I think the media all over the world, not only in Egypt or the Middle East, have made some sort of a panic all over the world. Everybody is panicking. Everybody is trying to get his throat and nose swabbed for PCR for the coronavirus, and this is a great misleading issue because again, coronavirus is highly contagious, but most of the cases, not more than 85% of the cases, are mild flu-like symptoms. The Egyptian government up till now is saying that in universities and in schools it should be business as usual, but it's not as usual like it's as usual, but with preparedness, with preparing ourselves if the virus will hold up, if there will be severe cases, and to prepare everything to have our the cleanliness of the persons, and even also the things which is prevented is to have a crowded, unnecessary gathering. Actually, AUC have from the first day, it is in very close contact with the Ministry of Health, Ministry of Higher Education, the WHO, especially the East Mediterranean region, also with the CDC instructions, the extent of disease control in the United States, and also the United States Embassy in Egypt. The precautions, I think one of the very important things that for travel abroad, we have a lot of our students, of our faculty, of our staff have international travel. Unnecessary travel should not be done in this time for a while until things are cleared. That those who are coming from the 4 areas which were declared by WHO that have a high incidence of COVID-19, they should, if they don't have symptoms, they should have a self-quarantine or a self-home quarantine in their home for 14 days. Number 3, if anybody on campus have some sort of, is not feeling well, he should consult his doctor. The clinic have a hotline. The personal cleanliness is the much more important thing, is cleansing and washing our hands. This is the most important thing. Not putting our hands on our nose and our eyes, because this is how the virus comes to the body through the mucous membranes. And again, if somebody feels unwell, he should stay at home and consult his physician.